Hey everyone, it's Dr. Erica Person, and welcome to another episode of the Flex Audiology Show. So today we are going to talk about, are headphones and AirPods bad for tinnitus? So whether you're a podcast beginner, a music lover, or just trying to block out chaos, noise, things like that, this episode is definitely for you. But first, if you could do me a favor and hit that subscribe button, that really helps us grow our channel, and I would appreciate it so much. So let's talk about headphones and tinnitus. So those two things, AirPods or headphones, they don't directly cause tinnitus. However, if you listen to them at very high volumes, it could lead to hearing loss, which then could lead to tinnitus. So highly correlated. If you have a significant amount of hearing loss, that can contribute to the start of tinnitus. It's a known symptom of that. So one study found that listening to 80 minutes a day on earbuds, headphones, even on the telephone, I think of those workers that constantly have headsets on all day long. So if you're somebody that has to do that, you're definitely at risk. Even if it's not showing up on a traditional hearing test, something that you're doing, it can be starting to diminish what we call the outer hair cells. That's a discussion for a whole nother day. But you can start to have the beginning stages of hearing loss and have it not show up on a hearing test. So just be super, super conservative if you are wearing headphones every day. So whether that is headphones, AirPods, or you work at a facility where you have to listen through any type of sound device like that on a daily basis. So just be really, really critical of that. So the main purpose of all that is just saying the loudness of it is what's going to cause things. So this is what I tell my children all the time. You can have the headsets on. However, if I say, hey, Mason, hey, Cora, and I try to get their attention without me yelling, they should be able to hear me. They don't have to know exactly what I'm saying, but they should be able to understand that I'm talking to them. So I apply that same rule if I'm exercising. I have my AirPods in. If they walk into the room and they say, hey, Mom, I need something, I know that they're there. I can hear that they're talking, and then they know. I give them the wait till Mommy gets done. I take the AirPods out, and then they wait. So and then you have to be really careful about where you're wearing them. So, exercise is one particular thing. So sometimes as we exercise, we tend to crank up the music because we can hear our heartbeat. Our breathing gets a little bit labored. But think about even just like a coffee shop or going to the gym, or even if you're just walking outside, we tend to turn up the volume a little bit more than maybe what we should, and that could be impacting your hearing thresholds and then therefore your tinnitus as well. So the main purpose, like I have a lot of people that when we wear AirPods, and I'm the same thing, when we pop them in there, it's actually closing up your entire ear, and it's what we call the occlusion effect. We say it's occluding the ear, closing it up. And if you've ever just stuck your fingers in your ears, you should try it. Your voice actually changes and it sounds echoey or in a barrel or inside your head, like a head cold. That's occlusion. So for people with tinnitus that have it, when you occlude the ear canal, it actually just makes your internal sounds a lot louder, and that can increase you will feel like your tinnitus is getting louder. And once your brain focuses attention on the fact that your tinnitus is spiking or getting louder, it will actually make it louder on its own because our brain is just that powerful. So it's not the actual devices themselves that are making the tinnitus spike. It's the fact that it's closing off your ears. You're not getting the extraneous sounds, and your brain is starting to internally focus on some of the sounds. So in audiology, if you do happen to have hearing aids, a hearing loss, and so we fit you with hearing aids, it's very important that we fit you with devices that aren't completely blocking off your ear canal. And that is one of the strategies behind Dr. Jastroboff's tinnitus retraining therapy, is that if you're coming in and your primary focus is tinnitus and not hearing loss, we're going to focus on the tinnitus. And if we're using some type of sound level mask or things like that, we just want to make really, really sure that we're not blocking up the ear. And I see that a lot because I get a lot of tinnitus patients. They come through the door and they say, you know what, I tried hearing aids. It actually made it worse. And in my head, I'm like, I know, because they probably occluded your ear canal because they were trying to focus on the hearing loss itself. So we have to do a lot of extra counseling to get them convinced that that they need to try a therapy that they've tried in the past, but it wasn't implemented and executed at a high level. So just be open to that. And so same thing with AirPods. I don't want to throw them necessarily under the table, but I have very tiny little ears, and I've tried all their different little pieces, and it doesn't matter what I use. It completely blocks off my entire ear. I just know that when I wear them, if I'm going for a walk or if I'm exercising, that my tinnitus is going to spike. And I'm just okay with it at this point. I'm not going to give up exercise just because of that. However, I have been debating, because a lot of my patients tell me that they get the bone conduction headphones, and I've heard that sound quality is super, almost superior, if that's a possibility, of AirPods, right? And but the bone conduction headphones, they do sit over the ears. They typically have a band behind, and they're just stimulating the sound through the bones in your head, and that keeps your ear canal open. And so when your ear canal is open, you're not going to notice the tinnitus as much, and it's not going to peak as much either. So definitely try that. Let me know if that helps you out or not. So kind of key takeaways: keep your volume probably around 50 to 60%. What I would probably recommend is that when you first start, have somebody talk to you and then just adjust it, because it'll kind of give you an idea of how loud it should really be. And now it's just kind of used to it. I just kind of know where to go on my phone. And then really, if you're somebody that has to wear a headset, just make sure you advocate for yourself that you can take breaks. Give your ears some relief, and then definitely you're going to want to look for things that have a limiter on it. So like, for example, I had to buy headphones for my kids for school, and I specifically bought ones that I could adjust the volume output, because those things are loud, and kids like to wear things super loud. So a lot of the stuff we do for safety for children, for some reason, when we get to adults, we tend to just let it all go to the wayside. So if you can find something that has a limiter, and that is one of the nice things about iPods, or excuse me, iPhones. I'm not sure if Androids have them. They probably do. The iPhones you can set it up to have a warning if sounds exceed a certain decibel level, anything that could create damage for your ear. So take a look for that. And then also, if you are somebody that has tried hearing aids and you have not been able to do hearing aids because of the tinnitus and it gets worse, and you're looking at treating both, definitely let us know. There's some really cool options that are available for people like that. And then we can look at some sound therapy as well with the open domes, to make sure you're not occluded. And really just reach out to your audiologist. If you're my patient, reach out to me. If you have questions, you can still reach out to me, even if I'm not your audiologist. And we can really sit down and strategize, because, music is so impactful for our soul. I mean, it's calming. It can get us excited. There's just so many uses and reasons why we're wearing AirPods or headphones or bone conduction headphones. We're just immersing ourselves in that kind of sound enrichment and joy. So we want you to be able to do that regardless of whether you have tinnitus or not. So if you have any questions, drop me a line. I hope you found this video educational and enjoyable. So let me know. Have a great day, guys.